during this time of COVID and other issues facing the nation that our students are manifesting the need for enhanced mental health and counseling services. So this is an important initiative. I am Dr. Wayne Riley, the president. I'm also co-chair of the SUNY Student Mental Health Task Force, along with Dr. Deborah Stanley of SUNY Oswego. Again, we want to welcome you. I want to acknowledge the first ever visit of our new Chancellor to Downstate as Chancellor, Dr. Jim Malatras. He's no stranger to SUNY, having served prior as President of SUNY Empire College, and before that as Chief of Staff to Chancellor Zimper. Congratulations, Chancellor. You've had a baptism by fire during this time. We look forward to working with you very closely here at Downstate. We also have our illustrious Chair of the Board of Trustees, Dr. Merryl Tisch. Thank you, Madam Chairman, for being with us. Great leadership she provides to our board. And we have two new trustees with us. First is Trustee Varlack. Yep, there she is. Yes. And then we have Trustee Crespo. Congratulations. Recent appointees to the SUNY board by Governor Cuomo. So congratulations. We look forward to working with you, trustees, and your contributions to this great state University of New York system. So we framed it as a very important announcement and presentation by our Chancellor about student mental health. And again, the tenor of the times requires us as educators and molders of young people to really pay attention to what's happening. The stress of the pandemic, the stress of the social justice issues that have beset the nation, the untimely deaths of 3 African-American individuals around the country, plus others. Now the presidential election and the sort of difficulty that has presented to some people, even within their own households, about different political beliefs. This has all caused stress, in addition to just the stress of them pursuing their higher education. So that's why this initiative is so important. And for the details of it, I want to turn it over to Chancellor Malatras. Chancellor.
Thank you, Dr. Riley. President Riley and I just had a meeting to talk about how the hospital and the university was going. And without Downstate Medical, we would not have had the response that we had in the state of New York to the COVID crisis. These are heroes of heroic proportion. What they do here every day to save lives, and then you add a pandemic on top of it, is second to none. I'm proud to be the chancellor of a system that has such a gem of an institution like Downstate, and we'll do everything in our power to help and support Downstate as we're going forward. And President Riley and I, before I became chancellor, worked very closely together during the pandemic. They opened their doors to whatever the state of New York, but more importantly, whatever patients in this community needed. So to Dr. Riley and his team of tireless heroes, thank you for all that you do.
Thank you.
I'd like to also thank Dr. Riley for his work, as he mentioned, on the task force on mental health issues, which is an important issue. And I want to thank President Deborah Stanley from Oswego, who co-chaired this initiative. As President Riley said, this pandemic has put a lot of stress on individuals, especially our students. This was not easy for anyone in society to do, but very much not easy for our students. So initiatives like this are important so students can focus on wellness and then on their studies so they can be successful in life. So thank you for that. And we're going to talk about some of the things that we're going to be doing. I want to thank our great Board of Trustee members who are here today, Dr. Tisch, our chair, who has been pushing this from the very beginning with me, coming in, saying we have to focus on mental health issues. These are important issues if we're going to have success. So thank her for her unyielding support, as well as Trustee Crespo, who he and I have worked together a long time in government, and his advocacy for students and his advocacy for healthcare is unparalleled. So I appreciate all that he's been doing, as well as Trustee Varlack. We've worked together in governmental capacities, and she is tenacious in doing good for our students. So her thoughts on this has been really important as we move forward. Just a couple of more people to recognize, and then I'll get into the details. I'd like to thank President Rodriguez of the University of Albany, Habadan Rodriguez, who is helping to expand some services with his institution today. He couldn't be with us, but I wanted to thank him and his staff for participating in this program, as well as 2 members of the system administration staff who work for the Chancellor in the Chancellor's office, Leah Wentworth, who is our Director of Student Wellness. She has worked a long time on this proposal. She's been tireless in finalizing this. We owe her a debt of gratitude, as well as Dr. John Graham, who is our new student advocate, who has been really working to better the lives of students all across the SUNY system. I want to thank those 2 for all of their work in the Chancellor's office. Also, I want to recognize 2 more people, and I'll get into it. Mark Cohen, who is the former president of the Student Assembly, he brought this to my attention several years ago when he was the president. He has now moved on to bigger and better things upon graduation, but Mark Cohen really deserves a lot for moving this process forward as much as he did. And then finally, my wife, Jenny Malatras, who is a psychologist. She does children and family services. She has been pushing this, especially because she works at the University of Albany, and she has found how traumatic this experience has been for many of our students. So I thank her as well. A couple of slides, because this is a really robust plan. There's a challenge before we even got to the pandemic, which is important to contextualize this. We did a survey a few years ago, and it found 17,000 SUNY students self-reported mental health issues in 2018. 49, nearly 50% of those students self-identified as having anxiety, and 36% self-identified as having depression. Of course, COVID-19, we've seen an uptick in mental health and wellness needs among our college students. It has really impacted our community especially, which deserves some more care. And you see what comes along with that: increased social isolation, anxiety, and grief. To add to this number from 2018, the CDC reported in August of 2020 that 75%, 3/4 of all 18 to 24-year-olds reported adverse mental health issues as a function of the pandemic. That's a real need. That is calling out for help. How do we help give folks the opportunity to have access to wellness programs, especially when you see numbers like that? And then even you see the prevalence among depression among graduate and professional students, people we often overlook in these situations, 2 times higher in 2020 as compared to the previous year. So the need is there, and our response has to match that need. So today we're announcing, because of the great work of the task force that Dr. Riley and that Deb Stanley chair, working with the Board of Trustees who told them to get to work last year, is a really comprehensive plan. The first basic piece is the most important. We will be expanding access to mental health services to every SUNY student across the system. That's more than 415,000 students all across our system. That is a big deal for us. It's a necessary piece, and we're going to make it happen in the following ways. The first is a new partnership we have with a program called Thriving Campus. And what it does is it will connect our students through a simple browser app on their phone, on their computer, to more than 6,000 licensed mental health professionals across the country, but most importantly, in their locations of where they attend school. So if they're at SUNY Morrisville or SUNY Delhi or University of Albany or Stony Brook University, no matter where they are, they can go on, click, this is what our needs are, get connected right away to one of their licensed health professional around them so they can get the attention they need. This is a big way of unlocking access to many students who don't know where to turn. So they get expertise, they get advice, and they know where to go because of this new program with Thriving Campus. Some of our campuses have been using this. They've been using it with great success. SUNY Oswego is one of those campuses, President Stanley being a co-chair. We're going to now expand this to all 64 of our campuses to give more than 400,000 students access to this program. Second, and this is because of the leadership of Dr. Riley, we are going to be using SUNY Downstate Health Science University. They're going to be joining SUNY Upstate Medical University to become a telecounseling hub for SUNY students. And this is how it works. This is important. This program will connect students to a physician, a psychologist, or a nurse practitioner on a secure online platform. So you can be far away but still get the care. right here from SUNY Downstate, right here using all of the professionals that they have here. They're doctors, they're psychologists, they're nurse practitioners. They can get a wide range of mental health issues dealt with, ranging from anxiety to depression to eating disorders. We currently have 10 campuses that utilize this service. By Dr. Riley and his team agreeing to participate in the program, now becoming a hub for telecounseling, we're going to add 5 more campuses by the end of this year. Currently, we've had about 190 referrals or more than 1,000 appointments. So that has really helped give critical care to many of our students in a real-time way, and accessing what I like the most about this is all in-house. This is using our medical staff from upstate. Right. We're now going to take the professional staff of SUNY Downstate and really expand access to care for our students in a safe and secure way. Third, and I mentioned this, which President Rodriguez, and thank to him and his entire team, we're also going to expand the peer-to-peer assistance hotline, which is an important thing. There are times where this doesn't rise to the level of crisis care, but where students just want to lean on somebody, have a little expertise. There's an important peer-to-peer network that the University of Albany has created called Middle Earth. It's for their students, but they think it's important to take that concept and to expand it system-wide. So the University of Albany is now expanding their peer-to-peer assistance hotline to the entire 64 campuses all across the SUNY system. That's a big thing. So students who are experiencing feelings such as loneliness, depression, anxiety, uncertainty, they can call the hotline and they can connect with a trained peer, which is important. Sometimes they want to talk to their peers. They don't want to talk to a doctor. They want to talk to someone like them. But the peers are also trained to connect those students to appropriate mental health services, because sometimes the crisis is high. So they're trained for all of these things. And the hotline's open a lot, 1 p.m. Monday through Thursday, through 1 p.m. to midnight, 24/7 over the weekends. I think this is a big thing. So thank you again, of course, to the University of Albany and President Rodriguez for expanding this really important service to our students all across the system. The final piece, which is important, and Trustee Varlack actually raised this in a meeting we had before we came out today, is there's often a lot of stigma with mental health services. There are issues where people don't even understand that there's these services available to many students, right? They don't even know about these. So part of what we're going to do today as part of this expansion of our mental health services across the system is a public campaign. We're going to kick off a public campaign called Reach Out SUNY campaign, because right now we have a lot of things happening already which we need to support and raise up. The first thing is we participate and partner with a company, QPR Institute, which will train anyone in the SUNY system for free, a 1-hour training program online to help with crisis management. How can I help my fellow colleagues, my fellow students in a campus? How do I see warning signs, problem signs? If you're living in a residence hall with someone, you often see those warning signs first, but you need to be trained in that. We want to make sure people are aware that this service exists. Many of our students don't even understand, and they're not even aware that this exists. About 650 people have been trained. We want to expand this to where we have thousands and thousands of people trained at our SUNY systems across the network. It's free, it's easy, we've made the partnership. We want people to be aware that you can help your fellow colleagues in our campuses. Second piece is, which has been a fabulous program, we have a crisis text line, which is often the first line of defense that students can go to, but many students aren't even aware that that exists. That's the first level. I have a problem, I can go to this crisis text line, that can get me into these services that we just talked about expanding today, but they're not even aware of this. So we have to make our students and our system aware of this. So we're going to also launch a corresponding campaign so people can utilize these services, because the services aren't very helpful if people aren't getting the help that they need. And here's one of the ads that we're doing.
It's okay to feel overwhelmed, to struggle in these times. It's okay to be not okay, to hurt for no reason. It's okay to ask for help. SUNY supports you in good times and bad. Take care of yourself. Take care of each other.
So that campaign will go along. We'll be doing some video, we'll be doing social, some TV and radio. So we can now show the students what sort of access that they do have. And I think this is unprecedented access that a large system like the State University has offered. I haven't seen an example where we are the largest public university system in the country to expand access to 6,000 providers, most which will be no paid out of pocket for those services. Insurance covers those services is a big move. I think opening up access to SUNY Upstate Medical and now Downstate, the fabulous resources that we have at SUNY Downstate, where we can access those doctors and those clinical practitioners to help our students no matter where they are, I think that's a huge, important thing. And then I think training, helping one another is really important too. So we should all get trained in seeing those warning signs because this has been a really difficult time. Many people in this room have dealt with the COVID crisis. But after the COVID crisis, there's going to be another crisis. And there's always going to be something to look out for. And we always have to pick each other up and help each other out because SUNY ultimately is a family. We're not just students and we're not just faculty and we're not just staff. We are a family. And family always looks out for each other. I'm proud to come in at the end here while we put this all together. So I thank Dr. Riley for his work and President Stanley for her work and the Board of Trustees who made this really happen. This was a priority for the board. And they wanted action, and today is a real actionable agenda. So I'm proud of that. So with that, I will turn it over to our colleagues on the board if they have anything to say, and then end with Dr. Riley.
So thank you very much, Dr. Malatras. Thank you, Chair Tisch. Thank you, Dr. Riley, for having us here. I just want to sort of underscore, Chancellor, when you came on, one of the things that you said is that you were very focused on the students. And you have certainly demonstrated that. I think the expansion of this program, the creation and expansion of this program is perfectly timed, particularly as we go into the fall, as the weather changes, and as we are hearing of there being an uptick. So as a person who lives in Brooklyn and who comes from a community that is disproportionately impacted by this, I am extraordinarily proud to be a part of this, and I'm very hopeful and prayerful that it's going to be incredibly successful. So thank you for your leadership.
I don't think it can be said any better than Trustee Varlack just placed it, but to you, Chancellor, to President Riley, to Chair Tisch, and to everyone who worked to put this together. This really is responding to the needs of our community, to the needs of our students, to the needs of our system, and everybody who plays a role in it. SUNY has to once again lead the way, as the governor always challenges to be New York tough. But it's also part of that toughness is to admit that every one of us at one point or another needs some help, needs someone to talk to, and could use some advice. So I encourage all the students and the faculty and everyone at SUNY to really buy into this. Let's be SUNY tough, and let's be a part of this program and help get the word out to everyone of its availability.
Madam Chair?
Ditto.
Well, again, let me, on behalf of all of the mental health task force that worked on this initiative and have talked about it for the past almost year now, thank you, Chancellor, and thank you, trustees. Thank you, Dr. Tisch, our chair. The health of our students, not just the physical health, but the mental health of our students is incredibly important to providing them with the foundation to take their higher education and to go out and change New York City, the country, and the world. And I never forget for a moment that as a leader in higher education, that we have to keep our learners top of mind. And this is a tough time for a lot of people. And again, even as a physician, I think about the whole body, not just the physical body, but the mental health of my patients as well. And so this is very gratifying as a higher education leader and as a physician that SUNY is going to lead the way yet again in something that will have such a broad impact. So thank you, Chancellor.
Thank you, President Riley. With that, that concludes our event. We now have to get to work to actually make this happen.
That's right.
Thank you for all attending. And just one more thing, one more shout out because it's important. We met today, often overlooked in any crisis in a facility like this are the nurses. Now, I have a little bit of a chip on my shoulder because my mother was a nurse, so she let me know that they were the heartbeat of healthcare, and she was right. She was the
right.
heartbeat of the family.
She was right.
So talking to them is just inspirational because they don't stop, and they are on the front lines, and they run into the fire. They don't run out of the fire. So I just wanted to thank them for their time. We met with some of their representatives for meeting with us, and everything that we could do for them, we will. And President Riley and I are both committed to that, as well as the entire Board of Trustees. So thank you for that as well.
Thank you, Chancellor. Thank you. Thank you. Great. Now,